that patient had lung cancer and we would not have reported it like that. We did see the spot, they said, but we didn't measure it in the way that the AI could do it. So your AI really had value above us humans because we simply cannot do these things that a computer can do.
For this next story, I'm heading to the venture capital, and it's all about startups. Companies that play an increasingly important role in medtech, providing doctors with critical tools to solve complex problems. And to do that, it requires key relationships with medtech companies. And I have a new announcement for you today. Jeroen van Duffelen is the co-founder of a new startup based in Amsterdam. He's going to tell me more about it. Jeroen van Duffelen, absolutely brilliant to chat today. And I believe there is a new announcement, but just before we jump into that, just give us a little bit of a précis on what Aidence is.
So Edison is a company that's applying the latest in deep learning, AI, machine learning, and data analysis to analyze radiology images for the detection of pulmonary nodules, which are basically little spots that could be a sign of early stage lung cancer. And that's a company that we started in 2015, and now we're bringing that product throughout the rest of the world.
And what's the new announcement?
We've been talking to GE for a while now on how we could integrate, how we could partner, and GE is building a generic platform to basically bring different AI solutions to radiologists. With GE, we can scale up that effort.
You must be delighted.
Yeah, it's really awesome. And I know we've been talking about this for a while, and now it's becoming very specific. We signed the agreements, we're doing the integrations. So hopefully we'll be ready to actually start putting this in the hands of different radiologists.
What have been some of the major challenges of a small startup getting to know, a pretty seriously big company like GE Healthcare?
I think of course, the operation of speed that we have ourselves is at a different level than a GE, and the complexity of bringing a product to market for us is we'll sell one product, we'll integrate that in a hospital, and the user can use it tomorrow. I think the challenge with a company like GE is that going through the whole process of getting this embedded within the technology of GE, getting it embedded within the sales and support and deployment infrastructure of a GE, that just takes a while. But then once we're through that process, we're going to benefit from the fact that it can be deployed much more easily than what we could do ourselves with a small organization.
So, Jeroen, tell me how the process works.
It's not that a large corporate company sees you and or we see them and we're like, hey, we'll have this idea, let's collaborate on it. What we've noticed, and that's how we've actually developed a relationship with GE as well, is that all these big organizations that have a presence and a name in the market are looking for a reliable partner. So we had to first demonstrate that what we have works, that it adds value to the customers. So I think the reason why we got the partnership set up with GE is because of the reputation that we have in this industry and the traction that we've shown with our customers that we've developed ourselves. So it wasn't a matter of pitching the idea, it's really showing that what you're worth of basically as a startup.
What does imaging patient care look like in the next 10 years? What does it look like in the next half century?
There was a lot of promise and a lot of hype that artificial intelligence would take away the work of radiologists and clinicians. We don't believe that. Technology isn't far enough to actually be as smart as humans. So it will be assistive for the next 5 to 10 years. It will start to take over some simple tasks after 10 years, but it will not replace medical specialists in the next 25 years. That's what we definitely do not expect.
What you're doing is quite remarkable in terms of the rewards you get. You're actually doing something that will save lives. Have you seen the applications being used on the front line yet?
In November last year, we got a call from one of our customers just saying, hey, you yet again detected a lung cancer that we would have not seen without you. And this patient wouldn't have been detected, wouldn't have had any follow-up diagnostics. But the moment that your report was provided, we sent that patient for a PET CT and it lit up. That patient had lung cancer and we would not have reported it like that. We did see the spot, they said, but we didn't measure it in the way that the AI could do it. So your AI really had value above us humans because we simply cannot do these things that a computer can do. So that is the cool stuff. And that's the message that you then get forwarded throughout the whole company, right? The whole team chat is full about that typical example.
Jeroen van Duffelen, thanks for all the insights into the brilliant work.
Thank you very much.